Welcome to The Holistic Nurse with your host, Peggy Smith. Peggy will introduce and educate her viewers about the differences between alternative, holistic, and complementary medical therapies. Her goal is to empower the lay medical consumer to learn how to advocate for themselves. So now, please welcome the host of The Holistic Nurse, Peggy Smith.
Hello, welcome to this week's edition of The Holistic Nurse with Peggy Smith. Have you ever smelled lavender and instantly felt your shoulders drop, or peppermint and maybe you suddenly felt more alert? Scent is something that is so simple, so natural, has direct access to your brain, your emotions, and your nervous system. Today we're diving into aromatherapy, not just as a trend, but as a holistic modality that's grounded in both ancient tradition and modern science. But here's the real question. Is aromatherapy really healing or is it just hype? By the end of this episode, you'll know exactly how to use essential oils safely, effectively, and confidently. What exactly is aromatherapy and how does it work? It's the therapeutic use of plant derived essential oils that support physical, emotional, and psychological well being. The key mechanisms, it works with your olfactory system, your limbic system, which is your emotions, memory, and autonomic nervous system. And it has a rapid neurological response, faster than many oral medications in terms of signaling the brain. In simple words, if you inhale an essential oil, molecules travel through your nose and directly to stimulate the limbic brain, which is the same area that regulates your mood, stress, heart rate, and even hormonal balance. Common oils that most people are familiar with is lavender. It's often used for anxiety and sleep and relaxation. Peppermint is for alertness, helps you focus better. It helps headaches, and it can be a symptomatic treatment for nausea. Eucalyptus is respiratory support. Many of us grew up with the that chest rub that our moms and grandmoms put on us when we were younger. Tea tree oil is like a natural, nature's antiseptic. It's antimicrobial, and it's good for healing skin issues. I have a handicapped dog who's deaf and has a lot of ear infections. I use it to clean her ears, and it doesn't bother her at all, and it really smells better than an ear infection and seems to be relieving the symptoms. And chamomile is calming and anti-inflammatory. So if you're really stressed at work, I wouldn't recommend using chamomile because then you'll be sleeping at work and probably won't have a job to go to. Um, Lavender is shown to reduce anxiety and improve sleep. It's used in hospices and many palliative care and hospice settings. And more as hospitals are transitioning to integrative medicine, it's often used as part of that. The little hospice, welcome to hospice kit often has a lavender and a peppermint inhaler. And tea tree oil has been used for all kinds of antiseptic purposes. It doesn't burn the way the old-fashioned mercurochrome methylate used to burn, and it is gentle on your skin. It doesn't destroy the tissues of a wound. Excuse me. It's important to mention too, with some of some people are extremely sensitive to smells and scents and even burning wood or burning sage or things like that. So if you're one of those people that are sensitive to that, it doesn't mean that this might be unsafe for you, but you could use it in a diluted form. If you're using any oils topically, like to rub on your skin, it should be mixed with a carrier oil, like a massage oil. It shouldn't be used just 100% pure on your skin. And with my animals, I put it on the outside, lavender on the outside of their collars, not next to their skin. And I have seen in my own little scientific or not so scientific studies, it keeps the dogs calmer and everybody seems to be in a better mood. So there are a lot of clinical applications. Like I said, hospice and hospitals use it for pain. Um, the integrative medicine clinics, home self care routines include. You might light a candle at your bath. You can burn sage to clear out any negative energies in your house. Use for anxiety and stress. There's multiple randomized clinical trials that show lavender does reduce the level of stress compared to mild anti-anxiety drugs. For sleep, aromatherapy can improve your subjective sleep quality, especially in elderly and hospitalized patients. And with the elderly, because drugs stay in the system a lot longer, um, unless there's an allergy or a reason that it would be contraindicated, it's actually much safer for an elderly person. They basically stop giving most elderly people things like Ambien and Remeron because it does stay in the system and has a cumulative effect. There is no cumulative effect using the oils, but everybody should always be drinking extra water no matter what your medical concern is. With pain, the studies are a little bit mixed, but it's beneficial as an adjunctive therapy, not a replacement for your traditional pain meds. Um, we live in a world where sometimes it's harder to get the opioids and other traditional pain medications, or we have limitations on how much acetaminophen and ibuprofen products are safe to use, depending on your other comorbidities. But if you use some of these to help you relax, the pain medicine works a lot better. And for those who are taking pain medicines regularly, many people don't realize trying to not get addicted or not use too much and get constipated. They wait until it's too late to really benefit from the pain medicine. If you get ahead of it, take it before the pain is really bad, you'll have a lot better results. Nausea, peppermint and ginger oils are effective postoperatively, also for chemotherapy side effects. Um, crystallized ginger that you can buy at a health food store or the nut and candy aisle of the grocery stores. That really is a very good way of managing nausea. You can also have it in your tea, a ginger tea, chamomile tea to help you relax. They call it, I think, sleepy time tea is one of the brands that's in the grocery store. And all of these choices are healthier for you and they're also less expensive. So, in the next section, we're going to explore how it's used in real settings and what the research says a little bit deeper than what I've already mentioned. With and we, it's important to keep aromatherapy. It's not a cure, but it's a complementary therapy. So that means it's not a replacement for going to your doctor, getting traditional medication. But if you use it correctly and safely, it can actually it's significantly enhance your comfort, relaxation, and improve your quality of life. Practically, most people use a diffuser of some sort, either an electronic one or you have those reeds in a little jar you can diffuse through that. That is safe and gentle. It's topical, as I said, is always used with a carrier oil, like, type that massage therapists use. And it's normally safe for inhalation for quick relief. And it comes in like one of those, like your sinus medicine that people inhale sometimes. Comes in a container like that. Um, but again, anybody could have an allergy to anything. So it's always important to be aware of what your limitations are. Um, with anybody that's traditionally very sensitive skin, it might be better to have it in a not so concentrated, so close to either breathing or skin issues. Um, with animals, I have cats, dogs, and parrots. When you have birds, you can't really use traditional air fresheners, um, but there are a couple essential oil companies that are natural, made right from the plant products. There's no additives, no commercial industrial additives to it. Those can be safe, but always use it very carefully. I don't actually use them in the room where my parrots are, but it's kind of a room that has wide open space and it's is at a distance and it's not in high concentrations. You can buy the plugins that we see in the grocery stores and the uh, hardware stores. Many people may not realize that your aromatherapy methods that come commercially in the plugins are actually toxic to cats. And when I first learned that, I'm thinking, well, gee, the pet store is selling a plug-in version for the pheromones, the hormones for the cats. Um, I was actually thinking that was a great idea. I was thinking I used it temporarily for my cats, and then I read that article. So again, everything should be well ventilated. This eh, plugins seem to make it easier, but there are studies that have shown that it has been actually fatal for cats that were in enclosed areas where those plugins were used. So basically, it's important to be, safe. You never want to ingest essential oils unless a qualified, perhaps an herbalist or something was recommending it. You always want to dilute it. You're not using it concentrated. Although a couple drops, like on your wrist or in your temples, that is safe to use. Um, but any other area, you're diluting it in the oil or you're diluting it in your diffuser with water. Good to use distilled water so you're not diffusing other things. And when you're diluting it, typically for adults, it's a 3% dilution for adults. Tea tree oil is also a good cleaner. So even if and of course, since I have animals, I clean with vinegar and water. Um, but you can combine. I don't combine my vinegar with tea tree oil, but I do have a tea tree oil spray that you can use as a diluted air freshener, like some of the canned products that are on the market. If you're pregnant, you should avoid certain oils, um, e- especially clary sage or rosemary in high doses. With children, you should be very cautious because it can cause respiratory distress. Um, if you have a baby that's very croupy, although it seemed safe when I was growing up, I was a croup baby and always asthma. Um, and my mother put that menthol rub on my chest. It seemed to be safe, but always talk to your physician and depending on how sensitive your child is. I had one that was, I called him my eczema baby. There wasn't hardly anything I could put on his skin or use around him. He was allergic to a lot of things. Many oils are toxic to cats and dogs. Um, so you can, and the market has tried to expand their markets to include the family pet. I have one dog, she's allergic to everything, and it's actually not that uncommon, whether it's the processed foods that dogs eat or just our environment, the way it affects our humans. Always be very carefully and look for signs. Don't just plug something in and leave your dog there all day for 12 hours if you don't know if it's going to be safe. When you have asthma and COPD, strong scents, strong perfumes can actually trigger an asthma attack, bronchospasms. We'll be right back after our break and we'll continue this. Thank you.
What if there were a super tiny device that could diagnose the brain and is smaller than a single human hair? What if you could see inside the brain to help an epilepsy patient during surgery or to help the fight against Parkinson's disease? Dr. Patricia Broderick is proud to announce the Broderick Probe, a biomedical and electronic breakthrough. Imagine a probe to help with the understanding and potential cure of brain-related diseases. To learn more, listen live to the Easy Sense radio show with host Dr. Broderick. And to help support the Broderick Foundation, please go to easysense.com and learn how, with your help, we can fight these horrific brain disorders. That's easysense.com to learn more and help support the Broderick Foundation. Author, radio show host, and coach John M. Hawkins reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness, Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them, rediscover and assess their core values, philosophies, and competencies, find settings that allow them to be the most productive, and track their progress towards accomplishing goals.
Hi, welcome back to this week's Holistic Nurse with Peggy Smith. Today we're exploring how essential oils and aromatherapy can be a good adjunctive complementary choice to our self-care and sometimes medical management of chronic conditions. Again, we're talking about, lavender is shown to reduce anxiety and improve sleep. Um, there's a lot of anti-rodent type uh, uses for some of the oils. Again, if it's going to be around your pets and you don't know if it's safe, don't just do it because the internet said if you have mice, you can use citrus and peppermint, and they don't like that smell. There's a couple little pouches you can buy that are nothing but aromatherapy pouches. Um, I've seen them in the past. Sometimes they work, and then I've actually had a little party in my basement. Apparently, everybody was chewing them up and enjoying them. The ones that I was trying to uninvite to my house. So it's it might help decrease it. I would not recommend that being your only choice if you have some kind of animal or insect issue in your house. But it certainly is safer to use, obviously, than poisons, especially if you have children and animals. So we know that it does help with anxiety and stress, but aromatherapy, any of the modalities that we talk about in this show, uh, they're not really part of a single use idea as the only cure for whatever problem, depending on, for simplicity, yeah, the ease of using it. Everything is meant to be used with common sense and in combination with everything. If you're trying to relax, you're having trouble going to sleep, first, make sure the lights are dim, you don't have your electronics on. That shuts down the blue light in your brain. You can use a lavender, chamomile, or have some chamomile tea before you go to bed. But you might also want some ambient music or the binaural beats meditations that we talked about in the show last week. Uh, you know, everything works better. When you're taking a medication, you that's not usually the only choice you have. But all of the complementary options that we talk about here hopefully give you an opportunity to use less medication. Just because medications all have side effects, insurance plans are not paying for all medications. There's a lot of reasons to look for alternatives, but make sure you're always talking to your medical provider. Um, there's lots and lots of research, but just because it says lavender is excellent for X, Y, and Z, there's different qualities of the products. So you always want to make sure that you know the source of your products. Any one of the common aromatherapy companies, many times they're actually marketed on a like a multi-level marketing plan. But if you do your research, you'll see that they are grown in the field, just like when you're buying vitamins. You want to know the quality and how much extra stuff is in it. And the two major aromatherapy companies that we're familiar with in America are pure oils that have controlled laboratory production with the plants that they come from. So we know that it can be effective. It's not your total choice. The end all for what you need to do. Aromatherapy, though, and anything, if you have a lot of surgical pain and the doctor gives you an opioid, you could be allergic to that. That's not going to be an option. So aromatherapy is not going to be for everybody, um, but certainly for people that are on the higher compromise level or younger or autoimmune, uh, you know, you just use common sense and, don't do it everywhere in your house. Maybe just do it a small area on your skin to make sure you're not sensitive or in a room. And all rooms should be well ventilated. Just for, even if you're spraying a traditional commercial air freshener, you still need to have your rooms, you have to have your rooms ventilated even more probably for the chemical products. Um, there are drug interactions with aromatherapies. So if you have some liver issues with your liver enzymes, some oils may affect that. And just because it's a holistic modality doesn't mean that it's not uh, unlike a medication. In that medications are processed through your kidneys and livers. So are essential oils. Medications originally come from plants mostly before we commercialized everything. And the ones that aren't coming from plants that are synthetic are still coming from the same principles that the plants provided. So anybody can be allergic at any time. So anytime you introduce a new product in your self care, your family, your children, uh, just use common sense and try a little bit. Make sure that there's no reactions. Um, Respiratory problems, of course. You know, uh, and I found visiting doing home care, aromatherapy. Um, Sometimes the younger population who is involved in other products that help them medically relax. Specifically, I'm talking about the medical marijuana and things, and they'll burn a lot of stuff or have the diffuser really concentrated to mask those odors. There's actually interactions between marijuana and some of these diffused products, uh, and the goal of if it's to hide another odor that you might feel is noxious, it actually can backfire and make people sick or increase anxiety. You don't want to try something new and then mix it with things, and when you 'cause if you have a reaction, you're not going to know whether it's a new drug or it's a new oil that you're trying. You always have to know the source, just like there's different qualities of vitamins, there's different qualities of oils, um, and everything works better in combination. Cancer patients often will take advantage of acupuncture, massages, aromatherapy. Um, the whole combination is what gets the job done. There's no one answer for everybody. The So how do you know with all this information to use aromatherapy safely, effectively in your life? Uh, there are a lot of consumer resources that are valid. One of the beginning steps, though, is when you try it for the first time. Always be aware and mindful of how your body's responding. And you might think you're not having a reaction, there's no problems, but you're feeling a lot, and your mood just has a drastic mood change from maybe before you use the oil. And you don't even realize sometimes that, that's a side effect, that's a sign that maybe that product, or at least in that strength, is not the safest for you. Certainly, if your goal is to relax and it's making you angry and combative, then you had just like a opposite reaction. People take Benadryl to relax and calm down allergy reactions. Or for some people, especially children with the food coloring, Benadryl can actually have the opposite effect and does not calm them down. But there's a National Association for Holistic Aromatherapy that is a valid resource to check things out. There's the Alliance of International Aromatherapists. PubMed has evidence-based studies on different products, what works best in different situations. And there's a National Center for Complementary and Integrative Health, NCCIH. Those are all reliable clinical sources that you can learn all about what is good. And seeking out many herbalists are very familiar with the complexities of aromatherapy and it can have good suggestions for you. Uh, but all of these aromatherapies can interact with prescribed medications. So it's very important, even something as simple as um, a citrus or some oils might interact with the anticoagulants, the coumadins, things like that. So it's, you know, just don't jump on the wagon for the latest fad. Do your research and make sure that it's right for your family. Um, we know that it's certainly safe for most people to help them sleep and get them in the mood. But again, if you combine a few complementary things, you'll get a better night's sleep. And the one method that most people forget about is they're busy Googling, how can I get a good night's sleep? And it's already 1 o'clock in the morning. They turned your phone off about 4 hours earlier. You probably would have had a better sleep. And we've talked about that. And lots of water. If you're using even topically, um, aromatherapy or you just have it all the time, again, you need to hydrate and hydrate and hydrate. And that is nature's cheapest medicine. We've talked about that many times. Um, if anybody has specific questions that they would like to put on the YouTube page, I'm happy to direct you to resources or answer some of those questions. Um, Tea tree oil is, one of the most common and one of the most oldest antibiotics, and it's really pretty inexpensive. You can buy it in larger bottles than your typical aromatherapy products, uh, and it can be used for, you can put it on a wound, you can put it safely cleaning your dog's ears out. You can just use it for all kinds of uh, clinical and dermatological issues. But if it's the first time you're going to use it, you could always, or if you know you're sensitive to a lot of different things, then be aware that you might also be sensitive to something in this class. Uh, so aromatherapy is most commonly used on with diffusers, and there's all kinds of very decorative um, devices that plug in or run on batteries. They have uh, the plugins in your car to go over your air conditioner, and that's a good example of a very closed area. You're trying to freshen your car. If you find that use one of those car products, and you suddenly have migraines, that might be an indication that you are sensitive, but it could also be that the commercial car products are not made without additives and chemicals, and that might be what's the processing might actually be what's bothering you. But you should always have your air conditioner on or the windows open too if it's a very strong in a closed area. But what happens when you're using an oil, the molecules go right through your nose and directly into the brain, and that can affect your stress level, your mood, your heart rate, and your hormone balance. There are many hormone medications that people take that actually might be contraindicted for the use of essential oils. And I will be having as a future guest somebody from one of the essential oil companies, and she'll go into deeper information about this. But we will be right back after our break, and we'll continue the discussion. Thank you.
Did you know that your beliefs create your entire reality, but it's the subconscious beliefs that do most of the creating. Belief shifter and life coach Shiraz can help you identify those limiting beliefs and eliminate them, often in a single session.
Like it was almost instant, like I had relief right away.
Creating better health, relationships, careers, and finances. Let Shiraz help you step out of safety and into awareness.
Definitely something's happening. It's like a flow inside. It feels good.
Whether in person or online, Shiraz provides personal coaching, belief shifting. Visit Shiraz at energeticmagic.com or call 416-529-7429. Energetic Magic. Find your greater happiness. Be well. Be aware. Be magical.
Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent, but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of The Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on The Caring Generation and PamelaDWilson.com.
Hi, welcome back to The Holistic Nurse with Peggy Smith. We're discussing how aromatherapy can enhance our self-care routines and just our overall well-being. Um, the idea of complementary medicine is so that we don't have to use as much as the traditional, more expensive medicine options. But aromatherapy is not a cure-all. It is simply a complementary therapy. It's not a replacement. So there are very few plants or complementary holistic type things that could actually have enough proof to validate that it's a cure. So make sure that anytime you're using something, you may not be aware of a drug interaction. So let your doctor know that, you've been doing this to relax, and is that okay? Um, there's even some interactions with the use of alcohol in some of the aromatherapy options. So do your research. Um, when it's used correctly, though, it does significantly enhance your comfort and your relaxation and your quality of life. But it's always it's actually you that's enhancing your comfort. And a lot of these things are kind of little props and tools. Um, doesn't mean they're not real. They have a real purpose, and they're contributing to the whole thing. But the mind body connection is what really does the work. It gets you relaxed. It helps you focus when you ask it to. Uh, it it can help you sort out. Ask inside all the time. You'll know. But just because this is sold over the counter and without doctor's prescriptions, especially if you have a complicated medical history, be very careful. Um, even around places like my litter boxes, and if I'm using a piddle pad with a smaller dog, I don't have any products around that they might have. But then I don't have normal animals either. Many of them have respiratory problems and skin problems. But just always be aware that there's no one fix for everybody. You should do a patch skin test, like just like an allergy doctor, to see how sensitive your skin is. Um, if you're trying a new makeup product for your face, you don't typically put it all over your face the first time. You want to make sure that when you go out in public, the first time you put it on, you're not going to be one big blotch, your face swollen up. And this is absorbed through the skin and through your nasal pores. So you get a pretty high concentrated dose. A little bit goes a long way. Um, and something that might be safe in its normal use, a whole 10 times that is not going to make the smells go away, or, make your skin any better. It really is a very concentrated form that you buy it in, and it should be diluted or used in very small amounts. Most oils come in little 1 to 2 ounce bottles, um, and it only takes a few drops. With chemotherapy help, a couple drops of oil behind your ear or on your wrist, lavender on your wrist, that can go a long way to keeping you relaxed. And if you're relaxed, your traditional pain medicines work better. If you're all tense, it doesn't matter how many pain pills you take, the pain's not going to go away. Uh, so understand what you're using, and just be patient with yourself, because everybody's different. You need to learn what your body needs. uh, but especially I want to reiterate with pregnancies, uh, this is not a medication, but it's certainly a medication like class of herbal products, plant-based products that many medications are made from. uh, but there are certain products that could increase your bleeding, they could affect your liver. They could cause more inflammation in your cause bronchial spasms, or if you already have COPD and the air can't actually get through the alveoli in your lungs. Uh, those are a lot of reasons to be very careful. Uh, Sometimes you can use aromatherapy products topically, like in a skin patch. There are some of them that come in that form. Always test though, put it in a small area that is not out, just in case you do break out in a big rash. And if you have a significant reaction, if you're prone to allergies, you could have an allergic reaction. And so if you're somebody that carries an EpiPen around, just be aware of what your sensitivities are. Um, and again, the only time you're ingesting essential oils might be in your chamomile tea, um, some of the peppermint tea, things like that. That does help your digestive system. Sucking on a peppermint can do the same thing, but a peppermint tea doesn't often have the sugars that a peppermint candy might have. So this is found to be for cancer patients a very, very helpful option to go through. It's important that you just do everything in moderation, um, and always let your doctors know what you are using, because they they're usually pretty aware these days. They stay up to date on what they call integrative medicine now. And when they're talking about, what over the counter drugs do you take, if you're a regular user of some of these essential oils, it's important to let them know, because something could interact with one of the medications that you do need. Um, if you prefer to do your aromatherapy with candles, people soaking in the tub, they like to have a candle in the bath. Just please be safety aware. Don't use candles if you've got cats, especially jumping around. But there have been many house fires just because of an exuberant dog happy to see you, and the tail wags over, knocks the candle over, um, or a cat singes their tail. Since I have cats in my house, when I use aromatherapy, I don't use candles with flames. I use a wax melter, or they have these discs that you plug in, and it heats up the candle itself from the bottom up, but there's no flame. And that's the safest way to use aromatherapy around animals in your room. Um, there is mixed evidence, and there's always going to be people that are allergic, but you just need to find out what works for you. And sometimes it works for you, but you're using it to an extreme, then can have a toxic effect. You could overdose on herbs if you had too many or the wrong kind. So make sure you always know the botanical name, what the basic plant is. Sometimes we look at our candles, we don't really read them the way we read our food boxes. But and they don't all have the same quality assurance products, QA testing and everything. Anybody can, yeah, actually, one of the major candle companies, started by the young man that started the company, who passed away recently, actually is a much older man. He wanted to get his mother a birthday present, couldn't afford it. So we melted his crayons and put a little bit of lemon and peppermint in it. And that was one of the first aromatherapy candle products that were on the market. But always be aware, understand whenever you have medications, um, know why the doctor's giving it to you. Because so many of my home care patients, well, you know why you're getting this? Because my doctor gave it to me. That's not a healthy answer. You should never put anything in your body that you don't understand what it's supposed to do and why you're doing it. We have, I think the safest ways are the diffusers, but you always need to be well ventilated uh, so that you don't cause trauma. Uh, if you're allergic to, say, as an example, it's not an aromatherapy thing, but if you're allergic to bee stings, you can't be eating raw honey because they have uh, bee stingers in the raw honey. So that's why you need to know what the ingredients are of everything. And uh, having aromatherapy is just as important to know what you have in your atmosphere as knowing what food you're eating and what the processed things are. Um, Eucalyptus is, great for sore throats. It's great as a chest rub on. It's great as a muscle rub. Many of our common muscle pain things use eucalyptus. Um, and it's usually safe, but if you're a very sensitive person, and it seems like because of all the additives and all the processed manufacturing we have, at least in our country, more and more people are sensitive that wouldn't have been sensitive 20 years ago, for example. Um, but the easiest ones are the lavender, peppermint, the citrus oils. They're good for, I remember my dear Italian mother-in-law. She cleaned with mothballs. Um, so you knew that my mom was done cleaning because the whole house smelled like mothballs. We've improved on aromatherapy. Her cat actually got cancer because of the mothballs. He wasn't ingesting them; it was just the fumes. Um, so it seems benign. You say, why would they sell it if it's going to do that? Again, that's a common answer. You can buy anything. You could patch it, you could actually take the remains of your kitty litter box and put it in a box with a ribbon and sell it to people as as nature's product, and it is nature's product. And people would buy it because it's all natural, not even knowing that what they're buying because of the label isn't properly. Um, you do get a rapid neurological response. That means that if you're inhaling something, it could lower your blood pressure really, really quickly. Uh, or some of the lavenders and chamomiles, they might interact with your blood pressure medicine, causing you to get dizzy. So if you're using things for the first time, be aware of getting up slowly when you're sitting down, and the ventilation in your room. Um, just be aware of the safety thing. Be aware of, the stress in your heart rate, what your normal vital signs are, because sometimes you don't realize, you're dizzy. It's not because you got up too fast. It's because you just took your blood pressure medicine, and the reaction was quicker than you were expecting. So we'll probably do a show in the future of exactly how to really understand what your body's telling you. We've touched on that in other shows, but this is an inexpensive, complementary option that is helpful, but it's not helpful for everybody. Um, and although many people, like I said, I'm leery about candles. They are not as safe as using a few drops. Sometimes people think, oh, well, a little bit worked really great. I'll put the whole bottle on, and then you have actually a toxic reaction. And you don't mix oils that you don't know what you're mixing. It's like mixing your cleaning products. You wouldn't put a bleach and another cleaning product together. Uh, Poison Control would be talking to you on the phone if you did. We'll be right back for our final break, and I will see you in a few minutes. Thank you.
author, radio show host, and coach, John M. Hawkins, reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness, Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them, rediscover and assess their core values, philosophies, and competencies, find settings that allow them to be the most productive, and track their progress towards accomplishing goals. Did you know that your beliefs create your entire reality, but it's the subconscious beliefs that do most of the creating? Belief shifter and life coach Shiraz can help you identify those limiting beliefs and eliminate them, often in a single session.
Like it was almost instant. Like I had relief right away.
Creating better health, relationships, careers, and finances. Let Shiraz help you step out of safety and into awareness.
Definitely something's happening. It's like a flow inside. It feels good.
Whether in person or online, Shiraz provides personal coaching, belief shifting. Visit Shiraz at energeticmagic.com or call 416-529-7429. Energetic Magic. Find your greater happiness. Be well. Be aware. Be magical.
Hi, welcome back to our final segment of The Holistic Nurse with Peggy Smith, where we've been talking about aromatherapy as a holistic complementary option for your self care. And my goal is always to empower you, the consumer, to take an active, informed role in your healthcare. Um, we scroll through all the Google things, and I do too. We all do. Um, but just because it's on Google doesn't mean that it's actually scientific. Do your own research, know what's worked best for you. Holistic, though, does not mean that it's not based in science, and scientific doesn't mean that it's impersonal. It comes down to common sense. You wouldn't just take a bottle of pills, a new vitamin for something just because you saw a commercial for it. I would hope not. Even those commercials that say "Ask your doctor if this drug is right for you." Uh, I've been a nurse 45 years. I believe that we shouldn't have to ask our doctors what's right for us. Some of those commercials, even I've mentioned it just on curiosity. Did you hear that commercial? What do you think of that drug? The doctor didn't even know what it was for. Um, but the pharmaceutical reps are hoping that if you ask your doctor, okay, I'll let you try it, but without even checking it out, you let the experts make the decisions when it comes to traditional things, but do it as part of their team. Some oils like eucalyptus and camphor can lower a seizure threshold in people that have seizure issues. Epileptics is one class of people that I didn't mention in this show. Lowering your seizure threshold means that it has an interaction with your anti-seizure medications that make them less effective. And you're more likely to have a seizure because it's not controlled. Uh, and serious things can happen if you're an adult, and you've got a driver's license and you've been controlled for 20 years. You don't want to just experiment with something that might lose your driving privileges because all of a sudden they think you're not controlled. Um, it's important to know the botanical names of what you're doing, know where it came from, the farms, make sure the sources are reputable. Uh, Remember that everything has medication interactions and, just common sense. When we bring holistic and scientific together, we can create something really powerful and better healing for whatever we're trying to heal. So, just remember that if you're caring for mind, body, and spirit, you do it naturally, but you do it wisely. Um, Next week, our guest will be Dr. Andrea Niestas. She did a very good show on 5 to 10 minute hacks for stress management. She'll be teaching us all about kindness and how important it is to be kind to ourselves. Um, so that's an exciting show to look forward to. Um, I know many of you enjoyed her show when she was here a few months ago. Uh, so, look forward to seeing you next week with that. Please stop by the channel and like and share and subscribe to Holistic Nurse with Peggy Smith. And I'm sure I'll see many of you next week with Dr. Andrea Niestas from Bakersfield, California. Um, Thank you and have a great week.
This has been The Holistic Nurse with host Peggy Smith. Tune in each week where you're encouraged to send in questions and receive private responses and suggestions if appropriate. Here's Saturdays, 1 p.m. Eastern.